Hello. Thank you for tuning in to this edition of Ask the Mayor. I hope you are well and your family is well. I've been eagerly anticipating this episode as it focuses on the Fredericksburg-based organization that has made us so proud over the past year. Since the time COVID-19 first jumped into all of our collective experiences early in 2020, Mary Washington Healthcare has worked tirelessly to keep our community informed and healthy. Over the past few months, their wonderful vaccine clinic has played a significant role in starting to restore life as we knew it for our community and its residents. We are truly blessed to have this fine institution and its thousands of associates leading our community through this most difficult year. From the very beginning, they have anticipated and met the challenge. So here to join me today is the President and CEO of Mary Washington Healthcare, Dr. Michael McDermott. Thank you so much for taking the time to join us.
Well, thank you, Madam Mayor. And I want to just thank you for everything that you've done to help lead our city and our community through a very challenging year.
Well, we have a wonderful staff and a great council, and we're all working together, indeed. But take us back to the beginning of 2020, and tell us about the moment when you first realized that COVID-19 was a threat and a challenge to our community.
Well, we all remember how 2020 started as a relatively normal year, and then the word started coming in about this virus coming over from China and the impact that it was looking like it was going to have on the world. And as we entered into March, that's when things started to change here in the United States. And we started to brace ourselves for the impact that this global pandemic was going to have on us. And we knew it was going to impact us here in Virginia and in our Fredericksburg community. We all saw up in New York the issues that they were having with surges in the virus's impact to New York City. And that's when we started to brace, really in the middle of March and heading into April, when we started to talk about having to look at the services that our health system was providing, starting to put off some of the more scheduled and elective procedures to help us build capacity for our community's response to this global pandemic.
So you truly had to restructure the way you were providing medical care to a certain extent for the community around the fact that you had this whole new thing to deal with.
Yeah.
And so little was known at that time about the transmission, the treatment, the long-term effects. How did you anticipate all that?
Well, it's not our first infectious disease that we've ever had to deal with as a health system or as a health community, right? And even here at Mary Washington Healthcare, just a few years ago, with the Ebola threat that was coming through the world, we were designated as an Ebola assessment hospital, right? So our health system has done a lot of preparation to prepare for these infectious diseases, right? And so it wasn't new to us. And we know ways that we can work with patients to keep one another safe and keep patients safe. Here, though, where we're talking, the biggest challenge was the surge that we might see with a virus that was as contagious as the coronavirus was, and where we saw other areas of the country being impacted by that surge. And so there were some decisions we made rather rapidly back in the spring to prepare for that, right? And there were investments that we made in our field hospital to add additional capacity in case it was needed, in case the actual capacity of our health system was challenged. And so those were investments that we made for our community's sake to prepare us in case the worst case scenario occurred. We're fortunate here that we never had to put that field hospital into operation clinically, but if we did need additional capacity, we were prepared.
Yes, and you did that early on. It was quite remarkable. So how has your organization's strategy in dealing with COVID-19 evolved over the past year?
Well, it was there were a lot of challenges that we faced over the past year. Global supply chains were challenged. The equipment that we took for granted every day, right? Having masks, having gloves, having gowns that are disposable items in our usual, typical day-to-day use became very, very much a scarce supply. And so when you're in that environment, we needed to change habits of how we worked. We needed to look to extend the life of some of these more scarce resources that we had in order to keep all of our associates who work for Mary Washington Healthcare and our patients safe. And so those were challenging times as the supply chain was disrupted. Also, early on, there was a lot of misinformation and disinformation. And when there's also fear and anxiety that comes with a lot of the unknowns that we had at that time. And so we thought it was important as a health system to be forthright with our community. We held town halls to try and fill some of those voids of knowledge with the truth, right? I'm a big believer that our community can handle the unvarnished truth, right? And there are things we know and there are things we don't know. And if you're forthright with people about the things we know and we don't know, people can handle that and they like to know the truth. And so we started to hold some community town halls on Facebook to try and fill that void here in our community locally so they could see what was happening here in our Fredericksburg region. And we think those went a long way towards making our community feel a little more comfortable in the time of tremendous uncertainty.
Those were vitally important too. They really were vitally important. As you said, there was fear and there was misinformation, which just fed on the fear. And to get the truth out and accurate information for people can deal with anything if they know what it is.
That's right.
And they know what the options are. So those were really vitally important to the community, and we thank you for them. Mm. What would you say was the darkest time of the pandemic?
Well, I think the darkest time of the pandemic, actually, believe it or not, was just after the holidays, at the end of the year, heading into the first couple of weeks of January, right? Because that's when we had our peak inpatient demand on our health system and our hospitals, right? And as the numbers of patients who had COVID-19 who required hospitalization care to help them battle it were on the rise, our system started to get under pretty significant stress. And that's when the preparations were put in place for adding additional capacity, operationalizing that. I think we were very, very fortunate that that's at about the same time that the vaccines were being approved through the FDA process for their emergency use authorization at the end of December. And we started to be able to vaccinate members of our community. I think very quickly in January, we were able to break that chain of transmission, a little bit of the coronavirus that was occurring. And we've seen those numbers on a significant downward trend since that point in time in January.
Speaking of vaccines, let's talk about the Fix Center. Your vaccination clinic has been compared to a Chick-fil-A in the efficiency of its operation. How did that come about, and who were the geniuses who designed it? Well,
it comes about through a team effort, and I'm very fortunate at Mary Washington Healthcare to work with brilliant teammates, right? And so we approached the vaccination clinic just like we approached a lot of the issues as we navigated COVID-19 in our community, which is let's start, let's build it, and then let's look at its results and optimize, right? We're very agile, right? Nimble, flexible, adapting to the circumstances. And within a matter of a couple of weeks, I think, what we've built and operationalized at our Fix Center for the square footage we have available there, and the number of individuals that we're able to vaccinate every day. We're doing over 2,000 vaccine administrations every single day now at the Fix Center. I think per square foot of space, I would put our vaccine clinic up against anybody. And I'm very proud of what the team's been able to accomplish there. We did it because it's mission-based for us at Mary Washington Healthcare, right? Our mission is to improve the health of the people in the community we serve. And so if we're looking at that mission, there's probably nothing we can do better now to help us meet that mission than to get our community vaccinated and safe.
Right.
And so we're putting a lot of resources towards the vaccination clinic for the benefit of our community.
Well, your mission has been constant. I know from having served on the board and serving on the foundation board, how much effort and training and money you expend in the community to improve the health of the community, to support other organizations, many small organizations in the community who are doing their part. But this has been huge. This will go down in history. There's no two ways about it.
Thank you.
And it's been compared to a party atmosphere. People are so glad to get there.
Yeah.
the folks who volunteer say it's so much fun.
Yeah.
And you've got people who are working all day in the hospital, nurses who are working all day in the hospital, coming over there at night.
It's been a tough year. There's no doubt about it for all of our staff, right? But like you said, the atmosphere in the vaccine clinic is one filled with hope and optimism. And there's a lot of gratitude for all of the individuals coming through there who are now able to protect themselves with these fantastic vaccines that we have available to us. And people ask me a lot, like, which is the best vaccine? And I'm like, they're all the best, right? Every single one of them in those vaccine trials, nobody was hospitalized or died from COVID who received any of those vaccines.
True.
That's amazing, right?
Yeah.
And so they're all the best. And they say, well, which one should I get? I'm like, well, if you're not vaccinated, you should get the one that you can get as quickly as possible, because it's the best health decision you can make for yourself at that moment in time. Get vaccinated as quickly as possible. And we're fortunate here in the Commonwealth of Virginia. We're on the cusp of open eligibility for just about every single Virginian, which is fantastic. It is really just days away from this point in time. And that's a great thing for our community. And so I do encourage everybody, get vaccinated as quickly as possible.
Thank you. Speaking of hope, is that the light at the end of the tunnel? Do you think you see it?
I think it is, although right now, at this moment in time, our hospitalizations have plateaued and are creeping up a little bit. Our test positivity rate and the number of new cases in our community is creeping back up a little bit. And so I think we are in a race against time here about getting more of our community vaccinated as quickly as possible to kind of continue that break in the chain of transmission that we were able to see here at the beginning of the year. So fortunately, we're going to have greater vaccine availability. It's going to be available in multiple places to get the vaccine. And I just encourage every single member of our community, if you're not vaccinated, get vaccinated as quickly as possible.
Absolutely. So is that the primary message you want us to tell people today?
I think it is, because it certainly is. Everybody can see the light at the end of the tunnel here. And that everybody sees this as our way out of this global pandemic and a return to what some consider, I wanted to go back to normalcy, right? And so getting everybody vaccinated is our way back to that sense of normalcy.
Right. And you and I've been vaccinated. I assume you have been.
I have been, yes.
We're wearing that mask.
We are, right? Because you still can't let your guard down, right? And you need to set good examples for others around too. And so mask wearing is still very, very important. Social distancing is important. Also, limiting your interactions with others when they're not necessary is important. And I know, a lot of people are talking now about the CDC guidelines that have come out for some private gatherings of fully vaccinated individuals, where they are able to have some standards that are a little bit more normal. But certainly in workplaces and other environments like that, we all need to still be very vigilant at this point in time until more members of our community are vaccinated and we see some of the case prevalence rates and the positivity rates continuing on their downward trend.
Well, thank you for that. I know that I am still not meeting with folks that I'm not normally around in any, confined large group area.
Yeah, and I'm doing the same.
Yeah, exactly. Well, what have you learned over the past year that you think everybody asks me this about the city, I'm going to ask you this about Mary Washington Healthcare. Are there lessons learned that will continue forward, that will shape our Mary Washington Healthcare in the future?
I think we've learned a lot of lessons over the past year, because it was a pretty extraordinary year. And we talked a lot about what was normal or what we thought we could count on. A lot of that was just set aside last year. I'll give you one other example that a lot of people probably don't think about, but even the economics of healthcare were tipped on its head. And you didn't realize how fragile those economics were until this pandemic hit. And I'll give you one example of that is usually the way we are able to run our operation, right? Have all of our nurses and everybody available to care for our community, is that when we provide services, a payment comes in for that from the insurance companies, Medicare, Medicaid, or the commercial insurers. Well, when we stopped doing elective procedures, and we still had tremendous demands from our community to respond to the pandemic, the reimbursement that typically came into us stopped abruptly because we weren't doing those elective procedures. And you don't realize how fragile you are as a health system and the economics were until that was flipped on its head. There's also something that's a little bit odd there, is that in the time of greatest need, health insurers were sitting on extraordinary profits because they didn't have any expenditures and they're collecting premium dollars, when healthcare providers had higher expenses than ever as supplies were in short demand and you're trying to scramble to get personal protective equipment at very high prices and you have no revenue coming in. And so all of those things that typically work in a balance got tipped on their head very quickly in the pandemic. And that's a learning about how fragile even these complicated systems are. They're very, very fragile at times. And so there were lots of learnings like that. I think counting on the supply chain, we lived in a world where we used to be able to make an order for something at 4 o'clock in the afternoon, and it would show up to our hospital by 10 o'clock the next morning. Mm-hmm. And we had a just-in-time supply chain that we could count on until a global pandemic hit. Mm-hmm. And all of a sudden, you're placing orders and things aren't showing up. And very quickly, you start to run into issues with that. And so I don't know if we'll ever take our supply chain as for granted as we did before. Mm-hmm. And so we are building up more inventory and capabilities as a health system that traditionally we hadn't done before. And it's not just Mary Washington Healthcare. I think every healthcare system in Virginia and around the country is doing the same, because we saw really how fragile some of these systems were that we had operated in and taken for granted before. So lots of learnings through the pandemic. It's likely to change how we operate moving into the future.
But one thing we have learned, you can mobilize and create a system that will vaccinate over 2,000 people a day, that will see the people that test it, that will see that people are not, winding up in the ICU. I mean, we learned that our healthcare system here can handle it. Yeah. And what's more, that you can mobilize a whole cadre of volunteers, including your own associates as volunteers, to do so.
Yes, I can't be any prouder of our team at Mary Washington Healthcare and what we've gone through in the past year. And a lot of that comes down to all of us recognizing reality for what it is, right? And taking the data and the knowledge of things that we do know and acting on it and accepting that reality, not hoping it was something else, but accepting the reality for what it was. And I don't think we made every single decision right last year. I don't think anybody could have. But when we recognized we were taking a wrong tact, we were very nimble, flexible, and adaptable and willing to change to get back on the right track for where we needed to be. And it's that attitude and mindset, I think, that our entire healthcare system had at Mary Washington Healthcare that led to us being so successful and navigating the year as successfully as we've been able to do.
Yeah. So again, what's the main message we want to leave everybody with today? I feel hopeful listening to you, that you feel like we're going to get everybody vaccinated and it's going to get better.
I do. I think it wasn't many months ago, you have to look back, where we would have thought having vaccines that are as safe, as effective as these vaccines was a long way away. And to have them available to us as quickly as they've become available to us is really extraordinary. And so these vaccination efforts, like for everybody to receive these vaccines, it is our way out of this global pandemic. And so again, my number one message to everybody at this point in time here, as we head into April, right, is to get vaccinated as quickly as possible, right? Avail yourself of this protection that you can have against this global pandemic. Protect yourself and our community as a whole and your loved ones from this. So I do encourage everybody to become vaccinated as quickly as possible.
Excellent. Excellent. Well, thank you so much, Dr. McDermott. And please, on behalf of the city of Fredericksburg and all of our community, thank your associates and your staff. We do appreciate the wonderful job you're doing.
Well, on behalf of them, I do accept your thanks. And I want to thank you, Mayor Greenlaw, for your unwavering support and the city's unwavering support and partnership through this very challenging year for both of us. We do appreciate your partnership, and we work together for the betterment of our community, and our community is better for that.
Thank you. Well, that's it for this week. Until our next video, enjoy supporting our local businesses while wearing your mask and staying socially distanced. See you around the burg.